for us. All right. So I am Sarah Love Sanderson. I am the outreach manager for Boulder Care. Boulder Care is a virtual clinic that specializes in treating opioid use disorder, alcohol use disorder, or both through medication. The medication we use for opioid use disorder is Suboxone. And then we use naltrexone and a few other medications for alcohol use disorder. So I am going to share my screen. I've got a little presentation here. And shout out to Layla. I saw her on the chat list here. She put on just such an amazing event this last Sunday, the Day of Dignity, which was just so incredible. So thank you so much for that.
Thank you, Sarah.
All right. So what is Boulder Care? So we provide long-term unconditional support for folks with opioid use disorder, alcohol use disorder, or both. We do this in a harm reduction lens, meaning we are non-punitive. No one's released from care for return to use or use of other substances. We understand that recovery is nonlinear and that there are going to be a lot of bumps along the road sometimes. So we understand that, and we work with our patients to find a recovery path that works for them. We do this by medication. So Suboxone, again, is the medication we prescribe for opioid use disorder. We also provide Subutex as well for those who are allergic to naltrexone, which is in Suboxone. I'm sorry, not naltrexone. My mind is blank. Um, Also, alcohol use disorder. So naltrexone for alcohol use disorder. We also have a couple other medications that we use. We also manage co-occurring conditions that come along with substance use disorder. So depression, anxiety, insomnia. We have some comfort medications for those going through withdrawal. Our clinicians will work again with the patients on what they're working with and prescribe those medications accordingly. We do not manage medications for severe and persistent mental illness. That will need to be managed by a behavioral health professional, which we can refer out, and we work with a lot of behavioral health agencies throughout the state. But we can manage the co-occurring conditions that come with SUD. A lot of our patients haven't seen a doctor in a while. We find that we've prescribed birth control a lot for some of our patients. So we can't do that basic PCP care, but we do refer out to community supports. So we are 100% virtual. We provide care through a proprietary app. We started in 2017. We saw our first patients in 2019. No intentions of becoming a brick and mortar. We want to be virtual to meet people where they're at. So transportation issues, disability, jobs, life, someone who can't make it to a clinic, someone who doesn't want to make it to a brick and mortar clinic. I worked for the recuperative care program at CCC for a number of years, and a lot of the participants that I worked with there had a hard time going to get methadone because their dealers would hang out outside. It was really stressful for them. So telehealth makes a lot of sense for a lot of people. Doesn't work for everyone. The barrier is participants, patients would need a phone with internet or cell phone service and a camera because our clinicians would have to see the patient. So that is a barrier. I understand a lot, especially with our unhoused folks, but we do what we can. So that is Boulder in a nutshell. We offer wraparound services. So our care starts with our enrollment specialist. They are the friendly, loving, welcoming voices that our patients will hear when they first give us a call, kind of the front desk of the clinic. They are very well versed in working with patients who are agitated. Sometimes patients will call us when they have started withdrawal already. So they're really wonderful at creating a really warm and welcoming atmosphere for our patients. They can also help troubleshoot any kind of app issues our patients have when they're downloading the app. We work with care advocates. They are similar to a medical assistant in a brick and mortar. They can take care of all the pharmacy issues, all of the insurance issues, anything that our patient doesn't need to deal with, our care advocates deal with. Then we have our nurses and prescribing clinicians, and these are the folks who are designing the care plan with our patients, prescribing the medication, working with our patient on their recovery goals and how to get there. These two are optional. We employ just an incredible team of peer recovery specialists. And of course, peers, I could talk an hour about peers, but peers, of course, are the wonderful humans who have lived experience and share that experience with our patients to help them through their recovery journey. And then we have a case management team as well. And our case management team works with community supports like yourselves to help our patients connect with SNAP benefits, housing referrals, shelter referrals, anything they might need in community, our case management team works with. And again, these two are optional. You don't need to use them in order to use Boulder services, but they are available. So if you have participants who are working with a peer in community or a case manager that they really love, I want to support that. We want to support that for them. But we do offer those services. So these are all the words I just said. I will, actually, Annie, I think I already did send you the slides. So I'll have these slides available for anyone who is interested in looking at them. So some of our outcomes, we really strive to keep people in the same day that they call or download the app. We know that there's just a real quick window there for recovery, and we want to make sure that we're available when patients are ready to start this journey. So 80% of patients are seen in less than 48 hours. Most patients are seen same day. If someone calls or downloads the app late in the afternoon or on a particularly busy day in the clinic, like the day after a holiday like Labor Day, it might get bumped to the next day, but we really strive to get people in same day. 62% of our patients stay in care for 6 months or longer, which is twice the national average. And of course, the longer someone stays in care, the longer they're going to not overdose, stay alive. We like our patients alive. 93% of patients are meeting their goals for reducing unwanted use. Again, we're a harm reduction program. This is the number that we get from our patients. We ask them monthly, how are you doing? How are you feeling about your recovery goals? And this is the number we get from them. Here's some lovely words from some of our Medicaid patients. I think it was 75% of our patients utilize Medicaid. So those are our people. So we're really excited about the feedback that we're getting from our patients, from our CCO partners about the care that they're receiving. We have an 89 Net Promoter Score. The Net Promoter Score is that it's out of 100. When you get that question, would you recommend us to a friend? 89 out of 100 would. So referring members to Boulder, there's really no wrong way to get into Boulder. You can give us a call directly at the 800 number. We are open Monday through Friday, 6 a.m. to 7 p.m. That's Pacific time. Being a telehealth company, we have clinicians who work on the East Coast, but are credentialed in Oregon. Our medical director's from Oregon. She moved to North Carolina to be near her grandkids. So we have clinicians who are ready to take Oregon patients at 6 a.m. Which I think is pretty cool. We also see patients on Saturday from 9 to 2. We are not accepting new patients on Saturday yet. I'm hoping that's in the future pretty soon. But we are available for refills or questions or anything like that. On the web, you can submit a referral form, super easy, just name and how to get in touch with the person, and we'll take it from there. If anyone uses Unitas, we can accept referrals through Unitas as well. Patients can self-enroll by these forms. Easiest way is probably just to download the app, answer a few questions, and then you'll be connected to our care team. We are partnered with OHP. We accept Care Oregon, Trillium, OHSU Health. The ones we are not partnered with at this time are Pacific Source, Providence Health Plan, and Kaiser Health Plan. We are also partnered with most private insurance, and we have a very reasonable self-pay option, which is $150 a month, and that's all inclusive for appointments, peer support, case management, anything they need. It does not cover the cost of medication, but we do have some coupons that we can offer for a pretty hefty discount on medication. So, oh, and there's another way you can get there. You can call me. I will include my phone number on here. I am happy to answer any questions either by you or one of your patients or participants, and I can connect directly to the clinic, directly to an enrollment specialist. So, dun, dun, dun. I'm going to, since we have time, swing through some of these slides here about what the app looks like from the patient's perspective. So Erica has opioid use disorder, heard about Boulder from a friend. I think the last time I checked, it was over half of our referrals are coming from word of mouth. So they're coming from the community, which makes me feel like we're doing an okay job. So friend here tells her about Boulder, downloads the app. This is Dr. Amy Potter. So all of the clinicians, everyone who works for Boulder full-time. We don't do any kind of moonlighting. Excuse me, like a lot of telehealth companies will do. They'll have a full-time job and then they'll work, doing telehealth for a few hours a day, which is great. I'm not banging that, but everyone here works for Boulder. So there's a real consistency of care. So this is Dr. Amy Potter. She is our associate medical director. She talks to the patient. They decide on a care plan, and she sends over a prescription for Suboxone same day. So our patients are able to enroll, see a doctor, get their prescription all in the same day. Starting medication, of course, we have fentanyl now, which has really changed the game when it comes to initiating buprenorphine. So there are several ways that we work with our patients to initiate buprenorphine, especially if they can't get into a detox bed, which I know has been a real stress for as long as I've lived in Portland, having enough resources for detox. So we'll do anything, depending on their supply, their comfort level, anything from microdosing and building up buprenorphine while they're cutting down on their use. Or another method that has been used on the street, for a long time. It's called the quick start method, where the patient will self-administrate a dose of Narcan, go into immediate withdrawal, load up on a very high dose of buprenorphine, feel like absolute garbage for an hour or two, but typically we'll go to sleep and wake up feeling relatively normal. We have a group down in Coos Bay, Oregon, Bay Area First Step, which is a fantastic organization. Their peers have a stabilization apartment. So what they'll do with their participants is if a participant is interested in the quick start method, they'll get them set up in the apartment. Two peers will stay with the patient, work through this withdrawal with them, make sure they're safe and taken care of, and then they're initiating their buprenorphine. So this is an example of a peer visit. This is Wesley. He lives up in Alaska. Super, super cool guy. So again, peers are optional, but if someone's really struggling, a clinician might recommend, hey, do you want to talk to a peer? We can just pull one into our visit, and a peer will be there. So a peer will appear. We have to test for buprenorphine in our patient's system 8 times a year in Oregon. We had been doing the oral fluid test, and we still do if it's requested. Typically now we're doing a point of care test, which is a urine test that we send to the patient. The patient gives a sample, not on camera, obviously, but they'll give a sample, and then there's a test strip that they show on video, and that shows the absence or presence of buprenorphine. It does pick up other substances. Again, we don't release people from care for having cannabis or stimulants or even fentanyl in there or opioids in their system. But we will have a conversation, do we need to adjust your care plan? Do we need to adjust your dosage? How are you doing with this? So that is that. And then this is an example of a co-visit. Again, a lot of our patients haven't seen a doctor in a while, or they have a lot of medical trauma, and we really want to support our patients. So if they have a friend or a family member or a peer support or a case management, person that they want in their appointment with them, with a signed ROI. Anyone can join a visit. And so that way they're more comfortable in speaking with our doctors and helping in their recovery. Two things I don't think I mentioned. We do have an entire care team that is fluent in Spanish. So anywhere from enrollment specialists to the clinicians and the peers and the case management. Other languages, we do bring interpreters in with an ROI. Our clinic, we don't do appointments. What we do is it's designed like a drop-in clinic, Blackburn Center has a drop-in clinic. I can't remember what days, but they'll come and they'll sign up and they'll wait until a doctor is ready, and then they'll come in. We have the same, only it's virtual. So you join a queue. You don't have to keep your app open. You can go about your day. Then you'll get a message on your phone saying the doctor's ready to see you. You'll just, you'll have a few minutes to find a quiet place, make sure your internet's good, your camera's on, and then you can have your appointment. So you don't have to spend the entire day in the clinic waiting for someone. You can just do it on your phone. I think that is about it. So I'm going to stop sharing, and I'm thrilled to take any questions you might have.
Feel free to just jump in. It looks like Debbie has a question.
Oh, okay. I can't see any hands.
Oh, okay. Hi, Sarah. Thank you for the, the speech, and that's really good. I do have a question though on the imperial outcomes I was looking at. You had the 80% and the 62% and 93. Is that how many people is that? Is that out of 50 people or?
That is a great question. So historically, we have served over 15,000 patients. Currently, I think we have 11,000 active patients. So we're not just in Oregon. We are in Oregon, Washington, North Carolina, and Ohio. We are also expanding to 10 other states this year. So that is the total amount of patients.
Perfect. Thank you. That's awesome.
Yeah.
The other thing too was employment. We were talking about you guys have employment. I mean, you have that 1-800 or the 88. I'm just because I'm an employment specialist, so I'm just trying to figure out if there's any like employment opportunities for the peer support recovery.
Yeah, absolutely. We just hired a new peer support specialist for Washington State. But I can put a link to our career page and just keep an eye on it because we are growing rapidly. And so I know they just did they hired 47 new clinicians, right? So they are now also hiring more of the care advocate, peer support, enrollment specialist staff as well. So I will put that link in the chat.
And then one more. Do you guys have an office here in Portland?
We do. We're at 111 Southwest NATO Parkway. Again, we're virtual, so it depends on who's the office. A lot of the time, it'll be most of the engineering team who hangs out there. I am usually in community since I'm the outreach manager. I'm on the road a lot. But if anyone would like to see the office, please, again, I'll put my contact information in. Get in touch. I would love to show you what we're doing. Yeah, so we're right down next to the fire station on NATO Parkway. It looks like there might be some questions in the chat. Oh my goodness. Okay, where we are. Let's see. Is it possible to get a digital copy of the brochure? Yes, absolutely. Don, I will give you my contact information and we can arrange to get that to you. And then connect. Okay, perfect. I will get in touch with you, Linda. Thank you so much. Any other questions?
Peg had a question.
Oh, okay. Hi.
Oh.
I'm having some technical glitches. Sorry, hitting the wrong buttons and things are going where they shouldn't go. Yes, I did have a question. I was hoping to know a little bit more about the pay structure and the ease or challenges of the pay structure and how people find support if they're having trouble with payment. I feel like that's kind of the number one question we get from people is how am I supposed to afford that?
Oh, okay. So pay for our services?
Yes.
Perfect. Okay, so we are partnered with Care Oregon, Trillium, OHSU Health. So half of the Medicaid partners. So Health Share, for sure, we're partnered with. And so that pays for all the treatment and all of the prescriptions. So other than that, we do have connections with private insurance. So we take most private insurance. I'll have to look because it's a huge list. And then our self-pay options. So that one's a different, that's 150 a month. We do have a program called Boulder Assist, and that was put in place for our justice impacted folks who are leaving the jails and don't have their Medicaid turned on yet. And so we provide a buffer, I think it's 45 days, in order for them to get their Medicaid straightened up or private insurance, whatever they need to do. So, but that will cover the cost of treatment for sure.
Thank you.
You're welcome.
Awesome. And there's one more from Alyssa. I might have missed this, but do you take Medicare?
Yes, we do. Actually, we take all the Medicaid CCOs that we're partnered with. We're also partnered with their Medicare. And then we also take veterans insurance, West. I have to look and see what it is. I'll also send a link to the insurance checker so you can put in whatever insurance and see if we're partnered with them. I don't know if anyone is outside of this Tri-County area, but we do have Measure 110 funding in Columbia County, which is St. Helens and Scappoose, and Deschutes County, which is Bend. And so that will cover the cost of treatment with Measure 110 funds. So, and we do have an option on our drop down about that.
Perfect. Also, one question that I have is, maybe you said this, but what age do you start treating?
Oh, thank you. That's a great question. We are seeing folks that are 18 and older right now, and this is kind of between us. We're doing a trial program in Washington State for adolescents, 14 to 17. It's limited to 25 patients. We are almost at capacity for that trial, but we still have a few spots left. And so I'm so excited about this. So we have a whole team that is treating adolescents. And once we make sure that is working, we can expand that to the rest of the country. So we'll have youth services in Oregon as well, because that's just a huge need. So.
Yeah, absolutely. Absolutely. Any other questions for Sarah? Awesome. All right, Sarah, thank you so much. This is such important information. And I love to see just, there's, I think COVID kind of forced a lot of us to think outside the box a little bit in how we offer care. And I love to see this option, being a virtual option. Doesn't fit, everyone's needs, but definitely there's a huge group out there who needs your services and obviously is using them, which is awesome. So thank you so much for the work that you do. And if you wouldn't mind putting your email in the chat.
Absolutely.
To connect with you,
yeah.
that would be amazing.
Yeah, please reach out with any questions.
Awesome. And then this Friday, I will include Sarah's slide deck in our weekly resource email. So you will receive that as a follow-up.
I'll send it to you as a PDF, so it's not.
Okay, great. Awesome.
All right.
Yeah, our weekly resource email is constantly exceeding budget, so I just keep going and crossing my fingers that it won't break anyone's system. So
all right. Thanks so much. I'm going to hang out for a while. So I'm excited to talk to anyone who wants to hang out.
Awesome. Thank you so much. Appreciate you. All right. So that wraps up our presenters today. And now I'm going to open it up. It looked like there were a few of you who shared some information in the chat around upcoming events. This is your opportunity to share it out loud if you'd like. So if you have upcoming events or anything, resources that you're looking for that you'd like to request input on, this is your window of opportunity to share. We'll start with Peg. Go for it.
Hi, everyone. Sorry, I hit go too soon in the chat. So I'm going to repost. Reach Community Development is who I work for. And as a programs coordinator, I do a number of things. One of them is our employment support. And as our employment coach and employment support, we are putting on an employment support day and job fair coming up this October, the 23rd. And in the chat, I'll be posting the flyer and the links so you can find out more. What we're looking for is twofold. We're focusing on residents in low-income housing, specifically those in North and Northeast Portland, kind of focusing on agencies who are in the Northeast Preference Policy, which is a way for us to really, as a community and a city, support the efforts to give back to communities that have been historically marginalized. So in doing this project, we are going to have a job fair. So I'm looking for employers to be signed up. We're looking for about 20, 25 employers. And then I have another community room on this same beautiful property where we're looking to table resource support agencies. And we all know that resource support agencies are really key to getting people stable and self-sufficient when you start any new project, as employment can be. So my goal is to ask you all to see if you'll check it out and sign up if you'd like. There's a flyer for employers, which is for employers and nonprofit seekers. There's also a flyer for residents that live in low-income housing. So if you have low-income housing, specifically in North and Northeast Portland, please put that one up and connect with me because I'd love to talk more about it. Thanks, y'all.
Awesome. Thanks, Peg. Peg, if you haven't sent that information to me, I've received a lot of employment fair flyers in the last week. So send that my way and I'll post it in our weekly chat, our weekly newsletter. Thanks. Okay, Neil, you look like you might have had your hand raised. Oh, I think you're muted.
Yes.
There we go.
Yeah, I'm new to the organization. I represent Taurus, and we provide free English instruction for people both online and also in person at 5 libraries. And we had 6,000 visits last year. So I wanted to just introduce myself and tell you a little bit what we do. We also have language fairs. We have an app for people, and we cover almost every language in the world have been in our learners. And we have chat in Japanese, Russian, Spanish, Swahili, Mandarin, Korean, and Vietnamese. Plus we train teachers. So that's just my short introduction because it's my first time. So thank you very much.
Awesome. Thanks, Neil. So glad you could join us today. And is it, you said in 5 different libraries.
Yes.
Do you have the names of those libraries offhand?
I think I do. Let me just see. Gresham, Rockwood, Holgate, Gregory Heights, St. John's, and also the Slavic Center.
Awesome.
And we also, at the Slavic Center, we have a special program for Afghan refugees for free English instruction.
Amazing. Amazing. And do you have a link to your website?
Yes, I can put that in the chat room.
That would be great. And you said they're free.
They're free, yes, for non-English speakers, and both online group classes and also in-person classes. So we do all 3.
Okay, what a great resource. Thank you so much. Awesome. Yeah, if you can pop that in the chat when you get to it, that would be great. And then I'll add that to the weekly resource email. I did see your email come through, so I look forward to connecting. Okay, anyone else? Anything to share about your program or an upcoming event or a success? Layla, do you want to share about your event on Sunday? I don't know if she's in there.
Yeah, I'm here. I'm so sorry. So, so yeah, actually, so the DPI staffing was there, along with Transition Project, Central City Concern, Multnomah Department of Health, the University of Western for chiropractors, and it goes on and on. And thank you so much, Boulder Care, Sarah, for being there. I was very impressed. Even though we've been doing this for the last 12 or 13 years, this particular year, somehow the media just got all over it. So it was posted in Oregon Live today. It was on Coin News, also K2 News as well. And each one stated the uniqueness of having kind of like a wraparound, event for specifically for the houseless and down in the Pearl District. That's where, a lot of commotion about the chronic houselessness is coming from downtown Portland. So what we thought we would do is have the event at the Pearl District outside in the park where the House of People feel safe. This is their area and they feel comfortable instead of being inside. And we also want Portland to see this as well, see the agencies that come together, see all the supplies that we're providing for the houseless, be able to talk to the houses. I mean, that was our main intent, is that too many of us think we know what the houseless want until you talk to them. And I was stunned, by some of the houseless people that I talked to. One was houseless, became a peer support specialist, came up to me. He said, people just don't listen to us. They think they know what we want and they decide this is what you're going to have. And then we don't want it because they didn't listen to us about our story. And that really resonated hard with me, thinking it's not just the giving, what we think we give so much, but also is the receiving, hearing what they have to say and do a check and balance, knowing, are we doing what they need from us? So I think that resonated hard, with a lot of agencies, with the media as well, saying, okay, are we able to communicate that to ourselves, basically. Also, we found tourists, downtown in that area in the Pearl District. They were coming around. They see this big event. They're saying, who are you? What are you doing? And what is this all about? And when they heard that, especially for out of towners, there was people from Japan that came and they were just intrigued about this. And when they heard about what we were doing, they were so happy with what Portland is doing for the houseless, and they congratulated us for that. So it gives Portland a good impression for tourists when they come here. They know about our challenges, but when they see this event, they think like, okay, you've got your act together and such. So all in all, it's about all of us here in Community Services Network, what we do for the people, and to continue doing it. But this is just a one day out of the year event to come together and to kind of be visible to everybody about that.
Awesome.
Annie, I could take at least 2 or 3 more hours talking about the native.
Well, Layla's been doing this for just a few years. This is your last one, correct? Not the last day of Dignity, but your last event for you. Is that correct, Layla?
Yeah, so I'm actually retiring from Islamic Social Services of Oregon State. And so I'll be on their advisory board, but I did this because I needed to make sure the agency can grow. And you can't grow if you dominate the agency and doing everything, and then something happens to you, and my fear, it dies with it. So it's time, after 22 years, it's time to hand the baton over to somebody else and allow it to grow. But no, Annie knows that she'll be bugging me to do things with her, and also I'm with ERCO as well and stuff like that. So I'll keep busy, but a little bit more low key within my old age pace.
Oh, Layla's busy is very busy. This woman doesn't stop. So I'm excited for you, Layla, and just thank you so much for all of your service over the years. And Layla's on our advisory board, so she is right in that we will keep close dibs on her.
Yeah, and thank you all. I mean, everybody here in the Community Service Network, thank you all so much. You are like my personal dream come true. It's going on with CSN, so I will always be with CSN. So thank you so much.
Yeah, absolutely. Thank you all for the work that you do. Definitely takes a village for sure. So anyone else have anything to share, any upcoming events before we move? Yep, Linda, go for it. Yeah.
I got to make sure I unmute myself. I was hesitant to share it because I've not locked down the location yet. So
Okay.
we provide prevention and education and support for the family and friends of those who've experienced domestic violence, right?
Okay.
And so we've been doing this for almost 2 years, and we have an upcoming training on teen dating violence for, once again, the parents and the friends who happen to know young people in their lives between the ages of like 18 and 24. So it's going to be November the 2nd. And I don't even tell you the location that I'm working on because we don't have it just yet. But once when I do, I'll be sure and send the email. So our classes are usually between like 10 and 2. And I almost always have either a licensed therapist or someone who works closely with survivors of domestic and sexual violence. And that person usually speaks about the last hour or so of our time. But it's been pretty successful. And so I'm excited about it. I truly am. And yeah, I think that's all I'll say because I can talk a lot too.
Awesome. And is there a cost for that, Linda?
No, it's free.
Oh, awesome.
It's free.
Perfect.
Right.
Okay. If you wouldn't mind sending that over to me once you have those details finalized, I'll post.
Okay. Thank you.
Thank you. Thank you. All right, Jonathan, go for it.
Hi, my name is Jonathan Malloy. I am the on-the-job training specialist here at Southeast Works. Just recently started this position on Monday last week. So excited to be able to help people in our community to be able to find that employment opportunity. Individuals that might not have all the skills necessary for the job they'd like to apply for, we might be able to work with that employer to be able to provide that person the opportunity, the time to actually get the training necessary to work on their productivity, for them to be able to hit those key milestones and points that pertain to their job. So if there's anyone in the community that is looking for that kind of opportunity, or if there's any companies in the community that are looking to be able to in the future hire individuals, but they might need a little bit extra training at work, please feel free to direct them to us here at Southeast Works, and I'd be glad to work with them and be able to kind of discuss about how we could be able to compensate them on that time period of them getting the training provided that they needed.
Awesome. Thank you, Jonathan, and welcome to your new role. Congrats. All right. Anyone else have anything to share before we move along? 3, 2, 1. Okay. I'm going to go ahead and stop the, if I can figure out which button I'm pressing here. Stop recording. All right.